Debbie Rice is the Director of Clinical Education at the Dutch Test and also maintains a micro-practice in which she focuses primarily on hormone and women's health. Dr. Rice obtained her degree from the National University of Natural Medicine, has worked with international healthcare communities, and received her Master of Public Health to continue her passion for national and international healthcare. She has extensive training in hormones and endocrinology from key leaders in the functional medicine world and continues to pursue her passion for education, learning, and getting her hands dirty in research and collaborative efforts. She enjoys speaking and working closely with other big brains in the hormone world. Here's a clip from today's show.
And see, this would be wonderful if we could be like, okay, I'm just going to look at serotonin, see what's happening there. And I'm just going to look at, cortisol and see what's happening there. Mm-hmm. But our body doesn't do that. Our body likes to, keep things we got to stay more on our feet. But cortisol as our stress hormone, now cortisol is supposed to help us put one foot in front of the other, keep us safe, keep us away from danger, out of harm's way. And cortisol is meant to rise with the sun and then calm down through the day so that you can go to bed. And cortisol and melatonin have this dance. Cortisol is the daytime hormone. Melatonin is the nighttime hormone. And cortisol is part of that nervous system response, right? So when we think of nervous system, we think of that excitatory, go, do, run, fight, flight. The other part of that is our parasympathetic nervous system, which is the calm, the sleep, the rest, the digest. And cortisol plays into that as well. When we are stressed out, our body's going to give us more cortisol, right?
Hey everyone, just a quick break to show some gratitude to our sponsors and give you some special deals. If you are looking for a trustworthy place to choose all of your supplements, FullScript has 285 different brands to choose from. They did the work for you to check quality standards for all the supplements they carry. These standards are important because they help to ensure a product is safe, effective, and accurately labeled. FullScript uses third-party companies to provide unbiased assurance that certain quality criteria are met when they add a company or product to their inventory. When you set up an account with FullScript, use my link and you'll always get 15% off your supplements. Thank you so much for joining us today, Dr. Rice. I really appreciate you being on.
Of course. I'm so happy to be here. Thank you for having me.
Why don't you give my listeners a little bit of your history and your backstory and maybe how you ended up at Precision Analytics?
Sure. Yeah. So I had always wanted to be a doctor, and I was studying for the MCATs, and when I was okay, I'm going to be a doctor, but I also want to be a personal trainer, and I want to be a nutritionist, and I want to do all the lifestyle things, but I also want to, fix the people. And when I was studying for my MCATs, my girlfriend called me and she was like, I found it. I was like, you found what? She was like, I found what you want to do. And it was naturopathic medicine. And she was right. I was like, that's amazing. Naturopathic medicine is amazing. So that is how I landed naturopathic medicine. And I ended up at Precision Analytical, which is also known as the Dutch Test, because my mentor was there. She and I had worked together for many years, and she started working there as their medical director. And she was like, hey, how you feel about, doing some hormone stuff? And I was like, well, we love hormones, so let's do it. And that's what started the journey with the Dutch testing and Precision Analytical. And here I am almost 10 years later with Dutch.
That's a great story. I don't know if you know this or not, but I've heard you talk on many podcasts before, and I did not know that you kind of fell into naturopathic medicine like that. That's a great story.
Yeah, it was a beautiful golden nugget that I didn't know I needed.
Well, and I'm all about root cause and figuring out what is really causing some issues. And I know naturopathic medicine definitely follows that trajectory to figure out and help clients and patients figure out what's really going on.
That's right. Yes. I always say that functional medicine, which is, I include naturopathic medicine in there, is the gray area of medicine, right? It's not the people that feel really good and don't need somebody, and it's not the people that feel really bad and have to be in a hospital or just feel really bad and need that acute care. It's the people in between that are like, I just don't feel good, but like, I don't know that I'm bad. So I feel like, functional medicine, integrative care is very good at the gray area. We have great tools for that, which I love.
Yes. Well, and the Dutch test is definitely a good tool to have in the toolbox. And that's one of the reasons why I wanted to have you on as well.
I think so.
Because that's one of the tests that I run for some clients when they're looking for a few more answers because their doctors either aren't running hormone tests at all on them or they need a little bit more information.
Yeah.
And so it really helps give a little bit more insight for their practitioners really to kind of help guide them and figure out what's going on.
Yeah, I agree. It is like being able to, instead of just being able to look at the car and the shiny stuff on the outside, it's like take a look under the hood and see what makes everything move and how and why. So, and I think that the Dutch testing is very specific. Its niches, sex hormones, so estrogen, progesterone, testosterone, and then adrenal hormones. We think stress hormones like cortisol and DHEA, very specific to that. So we have a very specific niche, and it just takes that information, kind of expands it, makes it a little bit more comprehensive in evaluation and treatment support.
Well, and hopefully a little bit later on, we'll talk a little bit about the Dutch test. So people listening can kind of figure out, maybe I should ask my practitioner to run the Dutch test or the Dutch Plus, because that's the one I like the most.
Yeah. Yeah.
So first, let's just talk a little bit about hormones, some general information, because I kind of have a passion for all things mood disorders, depression, anxiety, emotional, if you're emotionally an emotional type person. And I think a lot of people don't really think about hormones actually being related to that or the cause of it, especially when it's month, day in and day out. It's not just a certain time of the month, but it's a little more easy, I think, for people to figure out how it's related there. But when it's every day, I don't think that enough people, let alone practitioners, think about hormones being involved.
I agree. And I think a lot of times we silo out what we think are symptoms and how it works in the body, but our body doesn't silo things out. Our body is very dynamic and very intertwined. And our hormones, our sex hormones, that estrogen, progesterone, and testosterone are greatly influential, not only on their own, but also in symphony with other hormones. Like when we think of the brain hormones like serotonin and dopamine and epinephrine, norepinephrine, GABA, these are all things that help, with motivation and help you feel good and less anxious. And those are those brain hormones that we think about. And when we think about female sex hormones like estrogen, for example, estrogen has this very delicate, beautiful dance with serotonin. Serotonin relies on estrogen to be able to do its job. And I think sometimes we forget all of these things that, are tied into each other that can really influence how you feel when you wake up in the morning, how you feel when you have that to-do list and, that motivation that you have. When we think about testosterone for females, a lot of times we think, testosterone's, it's the boy hormone. But for females, it's also really important for our sense of well-being, right? Like our sense of our confidence and our brain motivation, like how we can tackle something. So those hormones really can influence that day-to-day like sense of well-being and desire to do things and how you feel about yourself at the end of the day.
Well, since you brought up serotonin and cortisol and dopamine and estrogen already, how do some of those different hormones directly impact our mood?
Yeah. So, and see, this would be wonderful if we could be like, okay, I'm just going to look at serotonin. see what's happening there. And I'm just going to look at, cortisol and see what's happening there. But our body doesn't do that. Our body likes to, keep things we got to stay more on our feet. But cortisol as our stress hormone, now cortisol is supposed to help us put one foot in front of the other, keep us safe, keep us away from danger, out of harm's way. And cortisol is meant to rise with the sun and then calm down through the day so that you can go to bed. And cortisol and melatonin have this dance. Cortisol is the daytime hormone. Melatonin is the nighttime hormone. And cortisol is part of that nervous system response, right? So when we think of nervous system, we think of that excitatory, go, do, run, fight, flight. The other part of that is our parasympathetic nervous system, which is the calm, the sleep, the rest, the digest. And cortisol plays into that as well. When we are stressed out, our body's going to give us more cortisol, right? So we can run from our saber-toothed tiger, or we can fight our enemy, whatever that looks like in our current day, right? Is it our job? Is it our relationship? Is it an emergency that happened? Cortisol is going to give you that energy to be able to deal with things. Cortisol is not meant to be a long-term solution to something. It is meant to be an acute response, an acute supporter so that we can be safe. When it initially happens, cortisol is going to feel good because then you are focused, you are able to do what you need to do, you're able to run, you're able to get things done. But if cortisol doesn't calm down acutely and it hangs out a little bit longer, it kind of overstays its welcome, that's when you start to get more fatigued and inflamed. And this is where you start to have issues with your body's not able to calm down. And because it can't calm down, you get these missed signals. And those missed signals can influence your brain chemistry, your metabolic health. So we're thinking blood sugar, weight gain, inflammation, swelling in the body. And it just doesn't feel right in your head, right? Because you're always on go, and it takes nothing for your brain to kind of freak out and be wait, what am I supposed to be doing? Where am I at? What's going on? So cortisol initially is supposed to bathe you in all the good stuff to get you out of danger. But if it hangs out, it doesn't feel good. It can feel overwhelming, overburdened, stress. You don't have as much of the calming support. So the feel good, rest and relax, you're really just more on edge all of the time. That's cortisol, which we need. I just think our day to day now, especially, ends up stimulating a lot more cortisol and puts us in that sympathetic overdrive. And our bodies don't know what it's like to be calm and relax and replenish ourselves. So that can feel a little overwhelming and fatiguing.
Yeah. And I know that I can definitely agree with that as well. I mean, no matter how much I try as well, especially we live in an Amazon world where we want everything fast and we want it now. And so we're kind of stuck in that a little bit when we are supposed to just sit down and eat our dinner, for example, and take a few minutes for our body to process it. But instead, I'm guilty of this. I stand up in the kitchen and, I'm trying to hold a conversation and do 4 other things rather than just sitting for 10 minutes, and just chewing my food and eating it. So yeah, that little things like that.
And there's so much medicine in just stopping. Yeah, exactly. The medicine in just stopping and chewing your food makes a huge difference in how your body can digest and absorb nutrients, right? Just that simple act alone, where a lot of us don't, right? Because we're busy.
Yeah.
Busy. Yeah.
And when you mentioned the swelling as well, I don't think a lot of people put those two things together too. I'm thinking of at least 3 people that I know, 1 client and a couple other people that I know that experience a lot of swelling a lot of times. And I don't think that they put that together too, that it's possibly hormone related, and which is cortisol in probably the scenario causing some of those. And if there may be something that they could do, it may not be or easy. It may be simple that they could possibly do to help alleviate those things. But
yeah.
What are some common misconceptions that people kind of have about hormones and mood?
I mean, I feel like you kind of touched on it. We're like, oh, my hormones shouldn't affect how I'm feeling, right? Like I mind over matter, I can do this, I can get through it. But again, I feel like that's very acute, right? Like you can mind over matter yourself a lot. But there's going to be a consequence when you ignore the signals that your body is trying to give you. Our body works the way it works because it's learned to do that, right? Like evolution has taught us to have these signals. So we know it's time to sleep. It's time to eat. It's time to stop. And if we don't give it that time, it will make us feel really bad and feel sick so that we have to honor that. And those, when I look at like overall day to day health, I call this the triangle of love. It's, one part of the triangle are your sex hormones. The other part of the triangle are your thyroid hormones. And then the other part are your adrenal hormones. And this is our triangle of love. And the reason why I call it that is because they all work together to give you your energy, your mood, your drive, put one foot in front of the other, day-to-day actions. And in the center of this triangle of love is all of your blood sugar, your insulin, how your body uses your nutrients and your food, right? So they're all so intimately intertwined and reliant on each other. And you can't just do one part of the triangle, right? Like you have to do all parts of the triangle. And when you're doing the full triangle, that means you also have to include what's inside the triangle too. Seems like a lot, right? Like now that we're listing it all out, then you're like, oh great, that's more stuff that I have to take care of.
Or integrative practitioner that can kind of help walk them through some simple steps to start with. Because, forward progress is still progress.
Yeah.
You got to start somewhere.
Absolutely. Absolutely. Even if it's, one step forward, two steps back, you're still inching forward and you're learning, right? I feel like a lot of times it's also just being able to sit and have awareness, because I feel like we are in a world that is just so fast that we are just trying to hold on, right? Like we are holding on to the lifeboat. We are just holding on. And so the fact, if we can be still for a minute and evaluate, take note of what's happening in your body, that's already a huge step forward. And then you can know, okay, this is where I see some issues. This is where I see I can make some small changes. Yes. Well, and those small changes end up having big ripple effects in your body.
Can people make that maybe would influence some of their hormone levels, which then again will influence their blood sugars and things? I know you said just being still and pausing. What other kinds of things can they do?
Yeah. Yeah. So, I kind of look at these as like your pillars of your like foundation of health, and sleep is a big one. You have to be able to honor sleep. Even if you're a little stressed out and your sleep isn't great, being able to honor that time for rest and relaxation, allowing your body to kind of slow down, is huge. Moving your body is really important, right? Like as much as our movement lubricates our joints, it also lubricates our brain. When the body's not moving, the brain is not moving. And so we want to make sure that you're moving your body. And then we also want to make sure that you're fueling it both with food and hydration. It's not just what you eat, it's also when you eat. And everybody is a little bit different depending on what's going on in their environment, how your constitution is. Some people need to eat every 2 hours. Some people, can do intermittent fasting and they work great, but it's very individual.
Yeah, I'm definitely glad
you still need to pay attention to how you're fueling your body too.
I just was talking with a client this past weekend who is experiencing quite a few hormonal issues, and she's having trouble sleeping. And I found out, little things like she has the phone right next to her bed. It's literally like a foot away. And so my first thought is, okay, what can we do to get that phone on the other side of the room, at least, first of all,
Yeah.
I gave her accolades because she was proud that she did not have an alarm clock in her bedroom because she didn't want the lights and everything on from the alarm clock, just the little lights. And I said, that's That's great. I applaud you for that. And she's like, yeah, because when I roll over and I wake up, I don't want to see
Oh,
what time it is and then start thinking, oh my gosh, it's only 4 o'clock. I got 2 hours yet before I should wake up.
yeah.
But unfortunately, the cell phone was like right next to her bed, and
Oh,
there's some other things too. But that was like,
yeah.
people don't put enough importance, I think, on sleep when it comes to their overall health, especially with hormones.
I agree. I feel like it's easy to write off sleep, especially if you are busy, right? Like, well, I'm just going to finish this before I go to bed. Or even if you're that busy mom and you finally get like 7 minutes to yourself and you just want to go into another room and like read a book, even though it means you're going to stay up a little bit later because you're going to keep reading through that chapter, right? Like, it's not because you are malintentioned, right? Like, you want to be able to have that time, but sleep is so critical. Like, sleep time is where our body replenishes itself. That's where it sends the cleaners in. It gets all the bad stuff out, because when we're awake during the day, we make things really messy. Our cells are, making bad things, and we're trying to detox all of these things. And that's what we're supposed to do, right? Like, that's how our body functions and works. But we make things really messy during the day. And nighttime is where the janitor crew comes in, like the cleaning crew comes in, cleans everything out, reduces the inflammation, sweeps stuff out, gets stuff out. And that's also why sleep is so important, because if you keep piling on and piling on and piling on and piling on and piling on, and you don't have enough of the cleaning time, of course your body's going to feel overburdened. Of course your body's going to be inflamed. Of course your body's not going to feel good. It has all these toxins.
Yeah. And since you mentioned it keeps piling on and piling on and piling on, estrogen is one of those things that your body makes, as well as other hormones. But during the day, your body needs to get rid of those estrogens, especially when it doesn't need them anymore. And unfortunately, if your body's not detoxing like it should be, you're going to end up with too much estrogen in the body and not enough progesterone. And you used the perfect words earlier, where it's like a symphony and a dance, and it's perfectly choreographed, and you have to let the body do its thing, and we have to help it along. And I don't think that people realize that.
That is so true. I think it's amazing to me how many chemical reactions are happening in our body on a daily basis. And if we just hone in on one part, like the estrogen, that in itself is already so complex and crazy and cool and amazing. And we want to be able to support our body's ability to get all the bad things out and support the good pathways, right? Because as you said, if you can't get rid of those, so when our body is metabolizing through estrogen, we make our estrogen, we have to make it a little messy to make it clean, but then we also have to get rid of the waste products and continue metabolizing things. If we can't get rid of the waste products, we keep just metabolizing all of this waste product. And that can also lead to, more levels of estrogen that may not be good. And that's where you start to create some of those hormone imbalances.
And when someone has something like that, what symptoms would you say that people should look for, just so people can take pause and think, oh my gosh, that's me. That's exactly what I experience. I experience those things.
Yeah, I think when there's not a good balance, especially between estrogen and progesterone. So estrogen is the main hormone that we hear of, for females. We don't ever want to forget about progesterone. I call estrogen like estrogen's Barbie and progesterone is Skipper, but still important. And estrogen, right? So estrogen, when we have a little too much estrogen can cause symptoms like breast tenderness, heavy periods, crampy periods, really intense, like clotting, migraines, mood changes, hot flashes. Those are probably like a nice little clumping of all of the things that can happen with too much estrogen. And we want to look at the balance between, is it because your body's making too much estrogen, or is it because you're not getting enough progesterone to balance the estrogen? I call progesterone the soothing mama hormone that comes in and kind of like calms down when estrogen just starts to get like overstimulated and overwhelmed. Progesterone can come in and balance that out and support that. So we want to make sure that we have good, appropriate levels of estrogen as well as a matching or balancing level of progesterone.
I think back to a lot of my life, especially after my kids were born and they started to grow a little bit. And I did experience a lot of hormonal issues. And I would say that there was a good 7 years where I experienced a lot of symptoms like heavy periods, lots of clotting, and all my life I had horrible headaches, migraines, and I would say that migraines were at least 20 plus days a month. But during this time, no one ever tested my hormones, not my gynecologist or OBGYN or my primary care. And really, honestly, that's not really his job, but nobody tested my hormones. But they did want me to go through multiple procedures and eventually ended up with a partial hysterectomy. And I wish I knew then what I know now, because unfortunately my body is not designed to get rid of all the stuff that I got rid of. It's not designed to not have a uterus or a cervix or my other ovary. Clearly my body had inflammation and was struggling, and I shouldn't have had to go through all that. And nobody should have to go through anything like that.
Right. And we always, whenever somebody tells me that they've had a hysterectomy, my question is why? Right? Like there's got to be a reason why. Was it because, you were miserable and you had migraines, or was it because you were bleeding so much, or, what was the reason for that? And I think that in conventional medicine, part of why they don't test is because then what do they do with that information? Right? Like, I don't know that they have good tools to act on outside of, oh, well, we'll put you on the pill, which, kind of, I call the pill the Wizard of Oz of your hormones, because it just, it goes behind the curtain and tells your ovaries what to do. Outside of that, what are they going to do?
And I would have loved to have known then, was I making an adequate amount of estrogen, or was I really just really low in progesterone, or was the estrogen also low and the progesterone was also low? I just wish that I could go back and at least test to find out if maybe that would have pointed us to the correct direction as to what some of those issues were. So I could attack some of those issues and kind of really address some of those root cause issues.
Absolutely. Absolutely. Yeah. Well, and I don't, as much as we would like to say that the sex hormones, right? Like we can evaluate the sex hormones. We do want to look at your sex hormones with thyroid function. We do want to look at your sex hormones with adrenal function, because when your body is stressed out, right? Like when you're running from your saber-toothed tiger, that's not the time to be all, oh, let's reproduce. Like I say, that's not the sexy time. Your ovaries are like, nope, it's not our job. We're not running from anything. We're staying safe. We're not going to do anything. So the body, in trying to protect you, sends these signals to say, nope, this is not where the ovaries get to shine. So I think that's an important consideration as well.
Yeah, I do know those were never tested on me either. And I can tell you that I have several clients just in the past year in my small practice that their practitioners and doctors are not running testing on them either. And I do try to recommend or suggest some tests that they either have their providers run, or I will run for them and have them show them to their providers, just to get some good basic general panels started at least.
Absolutely. Yeah. And I think I will say that I'm always a fan of information. So if we can gather information on you, why not? Especially if it can influence how we can optimize your quality of life.
Yeah, you mentioned quality of life, and I would definitely say I was lacking quality of life. And unfortunately, too many women are lacking it. And I think that they think it's normal when it's really just common. It is definitely not normal.
Agreed. And there are some people that will say, right, like, I don't believe in hormone therapy because we should be able to, support this naturally. And in the perfect world, we could, but we have a lot of unnatural things that our bodies are dealing with on a day-to-day, month-to-month, year-to-year basis.
Until the last couple of years myself, I was also under the impression that hormone therapy was not a good idea. And I still remember it being ingrained from a lot of years ago that hormone therapy causes problems, including cancers. And until I really entered this space that I'm currently in now, and I learned a little bit more, and don't get me wrong, I still have a long way to go. But I definitely think now that I would say to a client, and I do say to clients and to friends, hey, maybe you should think about getting your hormones tested and think about going on bioidentical hormones, and really think about getting them balanced to bring that sense of calm and make you feel more like yourself and a little more at peace.
Absolutely. Absolutely. Well, and what we find now too, when we talk about hormone therapy, that just the way that stress has entered our lifestyle, this was maybe 15 years ago. They were doing a study on 70-year-old females and 20, like women in their 20s. And the adrenal health of the 70-year-old female was better than the adrenal health of the 20-year-old. And when we look at that, our adrenal glands produce that cortisol. But our adrenal glands are also what come in to save us after menopause. So if you think about that, once your ovaries retire, they've taken their Mai Tai, they're on the beach, they're done. The adrenal glands have to come in and support that hormone production. So if your adrenal glands are already burnt out by the time you're 20, imagine what's going to happen when you're 30 and when you're 40 and when you're 50 and you're traversing that path of a cycling female to perimenopause to menopause. Your adrenal glands are going to be like, I ain't got nothing left for you, honey. Sorry.
Until I had gone through menopause, and I'm kind of actually really glad to be in this space now. And until I had gone through that, I never would have thought about my adrenal glands and how they actually had to step up to the plate and really help my body during this time. Because that's just one thing that I don't think people really touch on. They talk about hormones, but they don't ever talk about the adrenal glands.
Yeah. Yeah. Well, and we think about that too. We're spending, women now are living longer than we have, which means we're spending at least a third to a quarter of our lives, right, in postmenopause or in menopause. And we think about that. We also want to ensure that we can support a good quality of life as well. So, looking at hormone health for that, I think is important.
Can you tell us a little bit about the gut microbiome and how it impacts our hormones? Because I've had several people on my podcast in the past talk about that. And I hate to have my guests sound like broken records. And I don't want to sound like a broken record either, but I really want people to understand the importance of how their gut health impacts their overall health, but definitely your hormone health, which ultimately affects your brain health.
I think in everything, right? Like our gut, what we're realizing is our gut is really tied to so many systems, right? Like the gut-brain connection. And when we think about all of our nutrients and how our body has to use those nutrients so that all of our cells can communicate and do what they need to do, our gut health is paramount to all of our systems. And we're talking about hormone health. When we look at the gut microbiome, one of the things that we also talk about in the world of hormones is called the estrobolome, which is also just a really fun word, estrobolome. It's the estrogen microbiome in the gut. And our body has specific enzymes that support estrogen metabolism. And when those enzymes are not working well because of some gut dysbiosis or microbiome imbalance, that also means that our hormones are not metabolizing as well as they could. And when our hormones are not metabolizing, that's when we start to see those problems with hormone imbalance. So there is definite science and connection between gut health and hormone health. What are we getting for nutrients? How are we absorbing things? How are we detoxing things? That is all wrapped up into our gut health and hormone balance as well. So it's huge.
Oh, since you mentioned that, is that also shown on the Dutch test?
So it does not talk about the estrobolome. And because the Dutch test is a urine test, it's a dried urine test, we are only able to see what comes out in the urine. So that's when we look at detoxification. Our liver is a big part of that. And our liver has 2 phases of detoxification. We have phase 1 and phase 2, and we can see that in the urine. The next step for detoxification would be in the stool or, in our gut and seeing how well our gut is able to clear things out. So that's the next step after doing a urine test is stool testing to see gut health, gut microbiome, how the body is clearing things.
Okay, because I get really excited when you mentioned that because I do run stool tests on people sometimes, not as often, mainly I think because people don't really want to do that one, but usually it's because they're focused on a few other things in their health too.
Fair, totally fair. But I do think, when we look at gut health, it is important. That's why I say it is important what you put in your mouth, right? As well as when you put it in your mouth. But all of those things, those nutrients are influencing our gut microbiome. Our gut microbiome, our immune system, like the main part of our immune system is 70% or more involved in our gut health. So that's pretty huge.
So what can you tell us about the Dutch Plus test? Because that's the one I like to recommend. And it's the one that I mainly like because of the CAR, which is the cortisol awakening response. And that tells me a lot of information about what's going on in the clients that I see. I feel that people really struggle in that area a lot. And I'm all about brain health. And this really helps me see some of how their brain health is kind of working.
Yeah. So when you're doing a Dutch test, you are doing dried urine testing. The Dutch Plus is dried urine testing plus a salivary component. And the reason why we add the salivary component in there is so exactly what you said, so we can get that cortisol awakening response. Because the cortisol awakening response is something that has to be very specifically timed to as soon as you wake up. Then 30 minutes later and 60 minutes later is when we want to do a sample collection of your saliva because we're trying to see what your cortisol is doing. As soon as you wake up, what it's doing 30 minutes later and what it's doing 60 minutes later. And the reason that cortisol awakening response is important is because it's like a mini stress test for how well your hypothalamic pituitary adrenal axis is. What does that mean, Debbie? That means how well is your brain talking to your adrenal glands to manage your stress? Do you have an appropriate stress response? And we can see that in the cortisol awakening response. The other thing that's correlated with our cortisol awakening response can be mood. So we're looking at anxiety, depression, seasonal affective disorder, PTSD. We can see that depending on if your CAR is too high or if it's too low. So that is also another component of mood and hormones. So that cortisol awakening response is just that additional comprehensive view of how your body is communicating and responding to stress.
Some people are already familiar with regular hormone tests, but maybe you can explain the difference or why the Dutch test looks at metabolites and what the difference is.
Yeah. So when we're looking at metabolites, what does that word mean? So when we look at hormone levels, I would say the easy way to look at that is how much estrogen is your body producing? How much testosterone is your body producing? How much progesterone is your body producing? So it's telling us those levels, but the metabolites tell us, okay, now that we know how much estrogen you're making, what does your body do with all of those hormones? Are you sending those down the good pathways or are they going down bad pathways that need support so that your body can detox appropriately? So that's for our estrogen, our progesterone, our testosterone, but it's also for our cortisol. So we want to know how much cortisol does your body make, as well as what does your body do with that cortisol, right? Does it activate it? Does it deactivate it? How is that balance of cortisol happening when you're producing it and your body's going through that day-to-day reactivity for stress?
I know on the Dutch website, you have a list of providers that maybe can be helpful to people. So when they reach out to these providers, they can run the Dutch test for them and see if maybe they can get some additional support.
And that's the hard part is, at the Dutch test, we want to make sure, because we know it's a lot of information. It's very comprehensive. And we want to know that you have a provider that can help you maneuver this information for your better health, right? So that's where if you can find that provider that can, one, test the things that you want tested, and two, help you evaluate and come up with a good treatment plan, that's where you're going to get the golder nuggets.
Oh yeah. And that's for any test really. You want to make sure that someone you have is really going to help you navigate and give you insights on what you can do. And that's how I look at testing now. I look at it as insights and action, and it gives you information. I like any tests that I look at or I have my clients kind of work through. It's all about giving you information and action steps, whether it's your hormones or a stool test, but it's all about the things that you can change. And that's what I'm hoping that people really kind of understand too, is when you look at testing, it gives you information about things that you can change.
Absolutely. The testing does give you that capacity for evaluation and then hope for a treatment plan.
So at the end of every episode, I like to ask my guest for their don't miss this moment. It would kind of be their one real takeaway that they would not want the listener to miss and really kind of remember. So what would your don't miss this moment be?
I think the big thing is to remember that your body is a dynamic being, and it is constantly working with like multiple systems. I feel like sometimes we get into this static mind frame of like, well, this is where my level was, so this is where it's at. Remember, our bodies adjust, our bodies change, and they're consistently evaluating and reevaluating and trying to work for our better. And I think the more we can honor our pillars of health, the better that dynamic system can perform for us.
Oh, that's perfectly said. I think that we all forget our bodies are just trying to keep us alive and healthy, and they're doing the best they can with what we give them. And they're trying to get us back to a good place, and that our body can really heal, and it can change and it can improve.
That's right. It's trying. And as long as we can help it, it'll do its best for us. Yeah. So my Instagram is drrice.debbie. But you can also go to dutchtest.com. And there's all sorts of goodies on the websites there. If you go to the education tabs or resources tabs, you can check things out there. But usually, that's where you'll find any of the recorded podcasts. Yeah. And if you have any questions, you can also hit me up there.
Well, thank you so much for being on today. I really appreciate you taking the time to be here with us today and kind of go over hormone health, because that, like I said, is ultimately going to impact not just your overall health, but it's definitely going to impact your brain health as well. So thank you again so much for being on.
Oh my goodness, of course. It was such an honor to be here, and it's been so exciting talking to you. I'm happy to continue the conversation.
Are you looking for a good probiotic? Seed DS1 Daily Synbiotic has both prebiotic and probiotic. It supports digestive health, heart health, skin health, and gut health, including those who suffer with IBS. Their products are clinically studied and third-party tested for quality, and I think you'll be impressed with their eco-friendly packaging. Click the link in the show notes and use my code FORGIVEN for 15% off your first month supply. If you want to continue learning and hearing all things nutrition for your mind, body, and soul, click like, subscribe, or favorite me on whatever podcast platform you use, or you can find me at ForgivenNutritionist.com. This podcast was designed to educate, inspire, and empower you to achieve your health and wellness goals. It is not meant to diagnose or treat any illness or medical condition or take the place of any treatments from your current healthcare providers.